Hello, this is Dr. Vineet Kaul. I'm a head and neck surgeon in Gurgaon at Fortis Hospital. And today I want to talk to my viewers, especially all the students who are pursuing post graduation in ENT, about career in head and neck surgery. So a lot of people they are curious that should they do generalized ENT practice and or should they move to a specialized field like head and neck surgery while they are pursuing their post graduation in ENT. So I respect all the views that are out there. Everyone has their own views, and some people will guide you to do generalized ENT. Some people will guide you to do head and neck surgery. But this is purely my opinion, and I respect each and everyone's opinion. It all depends on your situation. So I'm going to share my personal experience where what happened during my post graduation, what led me to take this head and neck surgery as a career, move on this path. So I have done my MS in ENT from NSCB Medical College, Jabalpur. It is a very renowned medical college of MP, and the reason I took it up is the ENT department is highly renowned there. While I was there, I was under the department was under the head of department, Dr. R.K. Shukla sir, and I would say that he had a pivotal role in molding my decision to take head and neck surgery as a career path. So when I joined ENT as a resident, you do all the basic ENT procedures step by step. Few procedures in first year, few in second year, and few in third year. Now in my department, we used to do a lot of head and neck surgery cases, and Dr. R.K. Shukla sir, he used to encourage us and give us a hands-on in head and neck surgery cases as well, right from our first year of post-graduation. So that led to me, that developed an interest for me towards going into head and neck surgery as a career path. And I'm not going to deny, I personally as well love doing head and neck surgery, resection of tumors. I enjoyed them more as compared to the other ENT procedures like nasal surgery, septoplasty, tonsillectomy. So I enjoy doing these head and neck procedures more. As I reached my third year, I had to take the decision where to what to do with my career path. Now that is a pivotal point. So after you finish your residency, I feel that is the point that you should decide whether you want to move on this path of head and neck surgery or not. Because some people what they do is after finishing their post graduation they think that we'll join an SR-ship first, and then we'll see about any fellowship or MCH in head and neck surgery. I feel that what that leads is a little delay. So SR-ship always that experience helps. But since if you are at all going into head and neck surgery, you don't need to do SR-ship in ENT, because all that that time you can use to learn something else, and even to develop your practice in the future. That crucial time will be valuable to you. So I as soon as I finished my MSc ENT, I joined the head and neck department as a registrar in Artemis Hospital, Gurgaon, and there after a few months of registrarship I pursued my fellowship in head and neck surgery. So I finished my fellowship in head and neck surgery in 2 years, and after that I continued in Artemis Hospital and joined as an attending consultant. So I want to talk about what goes on to do into the fellowship of a head and neck surgery. So people are curious. Many of the students are curious. What are you taught there? Is it different? Yes, it is absolutely different, and it is very tough as well. Tough, but I'm going to say that I enjoyed each and every bit of it. So during your fellowship, initially there will be an orientation. You will take around 15 days to 30 days to get oriented. Now, the head and neck surgery, when you really pursue into that path, you learn that there are certain things you do differently when you are an ENT surgeon and when you are a head and neck surgeon. So your concept of oncology, of head and neck surgery changes, and your viewpoint towards outcome changes. So when we were in ENT, we a lot of ENT surgeons who were with me, who said that yes, we do oncology, but there are not good results. But when I came under the head and neck surgery department, I learned that there are few things you need to do, which are there, which research has been done on them. If you do that, your results, your outcomes will improve. So that's a change in the mindset, that this is what we are going to do. We are going to resect the tumor, we are going to resect the cancer, and we need to give outcomes, because this is our this is the job we are going to do for the rest of our life. So when you are in fellowship, yes. When the good thing about head and neck surgery and oncology is that the hours are fixed, and there are not a lot of night duties that you have to do. Yes, there are sometimes you get free late. Like many a times I used to get free from the operating theater by 8 or 9 p.m. Right from 8 a.m. to 8 or 9 p.m. So 12 to 13 hours of work we had to do in the operating theater. Rest of the OPD days, they would finish by 5 p.m. And sometimes, not always, the patients you have operated or some new patients might present to the emergency. As we all know, the emergencies of head and neck oncology are very few. So if there is some bleeding, rare bleeding, or as you all know, some striders and patient needs tracheostomy, then the patient will be in emergency. And what I did is I took an accommodation nearby, and I was 5 minutes away from the hospital. And when the patient came, I was given a call to come to the emergency, and I would reach in 5 minutes. So you don't have to do, you're not bounded by night duties. What I'm trying to say, that it's not like that today is a night duty and you have to stay in the hospital. You can go and you can do your other chores or other things in life that you want to enjoy. So yes, it is a little bit hectic initially, but once you get a hang of it, you learn to manage your time more efficiently as well, and then you get more time for yourself. And you will get exposed to a lot of different procedures which you would not have gotten exposed to if you do SR-ship in ENT or progress on a career path in ENT, such as you do a lot of malignant parotid cases. Because once a patient knows that there is a malignancy, he will always try to seek out an oncologist, a surgical oncologist. And if they come to know that there is a specialized head and neck surgical oncologist nearby, they will definitely reach that particular doctor. So some of the rare tumors which are malignant would reach us. You will also do a lot of thyroid malignancies and rare thyroid malignancies. Like during my ENT, I had hardly seen medullary or anaplastic thyroid CAs, but in my fellowship, I saw them quite frequently, and I also saw a lot of laryngectomy cases as well. So you do get exposed more to these kind of cases. You will get exposed to tumors of the oral cavity, not just classic squamous cell carcinomas, maybe some rare forms of maltomas or adenocarcinomas of the palate. And you also get exposed to skin cancers, which is very rare in our country, India. You do get exposed to skin cancers. You get exposed to rare tumors of the maxilla, of the mandible. You do see a lot of complex neck mass excisions. For example, very advanced paragangliomas or schwannomas of the neck. I also saw a lot of laryngectomies, and not just total laryngectomies. You also get exposed to, partial laryngectomies. Apart from that, see, the city that I'm in, Gurugram, we have a lot of robotic centers as well. So you also get exposed to transoral robotic surgeries, robotic thyroidectomies, and so on. So the exposure is different, and you definitely learn a lot. And then once your fellowship is done, you there is one another critical decision you have to take. So a lot of students feel that once I do the fellowship, I can, after fellowship I can become you do my head and neck practice, and then I can have a clinic of ENT as well. See, you can do that, but you will not be able to do that efficiently. And trust me, I am telling from my personal experience. I have tried to do that. You can open your exclusive head and neck surgery and oncology clinic, but doing both ENT practice as well as head and neck surgery practice is very difficult, because the ENT patient, most of the time they will bang on your door that we need an ENT doctor right now. And when you are doing long head and neck surgery cases, you cannot leave the operation theater to go see the patient in the OT or in the OPD, I mean. So that is very difficult to manage, and I would not recommend that to anyone, and even I don't do that anymore. I did for it for initial a year and a half, but then I realized that it's a futile thing to pursue, and I just focused on my head and neck surgery professional career. And I would say that thankfully I was in that good state of mind to take that decision, and I don't regret it. And that actually grows your head and neck profile more if you only do that. If you do some ENT practice as well, your profile of head and neck surgery will get diluted, so you don't want to do that. And your growth in head and neck surgery, it will be faster if you only focus on that. So that is something what I've seen. Then another thing, after the fellowship is done, after a year of shadowing a senior person, you can be, pursue on your own independent path of becoming a having your own department as a head and neck surgery consultant. There are a lot of avenues, lot of cases in India of head and neck cancer and other head and neck tumors, but there are not enough specialists to cater to them, especially the up country or peripheral areas, as we call them. People are not able to reach out to us. And what I've seen is that a lot of people think that people will not come to the main centers, the metros or the cities, because of affordability issues. That's not the case. It's I owe it to my patients to share this with you, that a lot of patients have come and told us that they don't have the proper doctors there. Otherwise the monetary issues, the financial issues are not a major concern for them. They just want the best treatment for themselves or their family members, and very rightly so. So what we need to do is just cater to the population properly, to the community properly, and you will not have any problem in getting head and neck surgery patients. So that's what I wanted to share with you, with all my fellow junior colleagues who are doing post graduation or who are thinking of going into head and neck surgery. So I hope this video has helped. I have shared my number, and you can also text me or call me, and if you have any questions or any doubts in your mind which you need clarity about, I will be very happy to connect with all of you and answer those for you. Thank you.